Welcome to H&HN Daily. I'm Susanna Hopsalerin, Senior Editor for Hospitals and Health Networks magazine. To increase connectivity and service throughout the community, this hospital invested in robust information systems and implemented a data analytics program. Today, I'm joined by Mark Herzog, President and CEO of Holy Family Memorial in Manitowoc, Wisconsin, and Jim Darren, Health Information Technology Specialist from CareTech Solutions in Troy, Michigan, to discuss building a culture where information technology is a strategic asset. Welcome, Mark and Jim.
Thank you.
Mark, I'm familiar with all of the innovations you've done at Holy Family Memorial. How are you using IT as a strategic component to drive innovation?
Our organization has embraced the fact that to do well for our community, we have to do things differently. We can't be beholden to the hospital-centric model that most of our industry is still part of. To do that with safety and quality requires a transformation that is predicated on having excellent technology and information resources so that we can measure what we're doing, so that we can plan ahead for what we are trying to accomplish, and ensure that we're doing so with great safety and outcomes. And being able to take advantage of a lean thought process and strategic approach to this has been fundamental for us.
Jim, what are some of the emerging technologies that you see supporting innovation in healthcare right now?
Within the hospitals, a number of things like positive identifications of patients started with barcoding, but the technology now is using biometrics to do face recognition of patients, as well as face recognition of the caregivers so they don't have to sign on and they positively and quickly know who it is providing the care.
Mark, how is IT helping you change how you're providing healthcare right now?
One of the biggest challenges for healthcare in doing any sort of transformation is keeping the caregivers and the support staff supporting them optimistic and excited about making the transformation. And we think there are two major roles that technology and IT have in that. One is so that we can assure that we're measuring what we're doing, so that we can say, here are the metrics that are going to make sure that you as a caregiver are providing excellent quality and safety, even as we're changing the paradigm that we're working in, shifting what patients who were, a few years ago staying overnight after a cardiac catheterization. Now, it's a very rare thing where someone stays even one night after that. But making sure that the staff knows that there's technology and safety mechanisms that they can rely on to make that happen. Secondly, this changing role of the caregivers requires a lot more bureaucracy, paperwork, challenging non-value-added tasks. To the extent we can use technology to take care of those tasks and give up more time for efficient patient care and direct patient care, that benefits everyone, and embracing the change made a lot easier.
What about the aftercare model and engaging with the patient on an ongoing basis and with the family in the home?
Well, I think that is actually the most exciting part of where I see healthcare right now. The idea that we can disintermediate or take care away from the hospital setting, where we've really got some excellent tools and excellent infrastructure, to the uncertain territory that is individual homes and individuals' behaviors, and also nursing homes and long-term care facilities. What we've been focused on is trying to build those bridges and give direct access to the information we have on our record to, for instance, the nursing homes. All nursing homes in our area have been able for years to access our patient data to take care of residents in their facilities. In fact, we've recently embedded our clinics in those facilities so that even the real-time data can start flowing both ways. In caring for the home-based patient, one of our most important technologies has been our portal, as mixed with our direct access testing and treatment program, where individuals don't have to go through a physician. They can come directly to our diagnostic and treatment facilities and get what they need on their terms and relate with the data flowing back to them through the portal, as well as other mechanisms of their choosing. So empowering the patients and having the data systems to make sure that the safety and quality is consistent with what we feel is our mission and values is vital.
I agree with Mark that connectivity is probably the number one thing that hospitals can pursue at a relatively low cost and get a lot of return on their investment. And the return on investment doesn't mean a monetary financial gain for the organization, but it improves a lot of and supports the goals of the organization by providing connectivity and engaging with the community.
When you're looking at the future model of care for Holy Family Memorial, how are you using analytics to help shape that vision?
Analytics have been important in allowing us to make wise decisions about how to reduce our planning risk, how to reduce our selection risk, how to reduce our execution risk, and ultimately how to make sure that we're able to meet the goals of improving the health of our community. And the ability to measure our care, the ability to measure the efficiency gains that we've been able to put in place and communicate that back to our staff has been vital in having them get enthusiastic, as I mentioned before, about the change process. Because the vision of caregivers is to do better for people, to do better for communities. That isn't necessarily a corporate vision, that's the vision of who we are as caregiving communities. And these tools have been embraced to an astounding degree as a way of making that more realizable within our resources and our constraints.
Thank you for joining me today.